Good evening. Today is Wednesday, April 8th. Welcome to the weekly live Facebook question and answer forum hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Vickery, Stanislaus County's Public Information Officer. We will be moderating tonight's live event, which will be recorded and posted to the Stan Emergency Facebook page and later to our Stanislaus County Office of Emergency Services YouTube channel.
You won't see us on camera tonight, but you will hear our voices as we help direct your questions to our panelists.
Joining us tonight is Dr. Julie Vachampayan, who we will refer to tonight as Dr. V, Stanislaus County Sheriff Jeff Dirksey, and Chair of the Stanislaus County Board of Supervisors, Kristen Olson.
Let's begin tonight with Dr. V for an update on the latest number of cases of COVID-19 in our county. Dr. V, where do things stand right now?
Yeah, so we have 95 cases so far in Stanislaus County, 0 deaths, and just under 2,000 negative tests.
Okay, and we have a Facebook question that we've gathered throughout the week. This one comes from Delia, and she wants to know, when will we get numbers of people who have recovered?
Yeah, so we have those numbers, and we posted them today for the first time. So 59 people so far have recovered.
Okay, we've got a third question that correlates with these first two. This came in from Facebook. I have heard that hospitals are not reporting all of the data, especially COVID-19 related deaths. Is this true?
So they are reporting to the county of residence of the person. So we've had no deaths, and so if they have had deaths in the hospital, it would be a non-Stanislaus County resident.
We'll stick with you for a second. Can you address this Facebook question? What does 13 county cases mean on our webpage?
Yeah, so when we divided by city, that leaves the unincorporated county area. So I think it's up to 18 today, and so unincorporated county are those numbers, all of those who do not live in the city limits of the 9 cities. And if we look at the population there, I'd seen someone ask about why that number's so high. So that's a little over 100,000 people. So the unincorporated county is about half the population of the city of Modesto. So it should be about half the cases by distribution, roughly.
So this question is basically along the same lines. Is it familial transmission, the unincorporated county high cases? What
we do know, I can't answer that specifically, but what we do know is that the transmission in households is the highest risk. So we see quite a bit of transmission in the household. So many cases are found. Once we find one person test positive, we will find other cases in the household. So it's not really familial. It's those close contacts that share the household.
Okay, that makes sense. So what if someone in your family contracts the virus?
Well, there's a lot of guidance out on CDC of what you should do to prevent that transmission. So the person who is ill, or all the people who are ill, should stay in their own room. They should use a separate bathroom. There's a lot of cleaning recommendations, and for the person who is ill and the person who are not ill, to a lot of hand hygiene and trying to just stay away that 6 feet from the people that are ill. The ill person should wear a mask, and just really trying to stay away and not infect anybody else in your household.
Thank you very much, Dr. V. This next question is for Sheriff Dirksey. There was a big announcement this week. The Judicial Council removed bail for nonviolent crimes, which are misdemeanors. Does this go into effect immediately? And what is the potential impact on public safety?
Yeah, so on Monday, the Judicial Council of California, which is headed up by the Chief Justice of the state of California, issued an order that functionally changed the bail schedule for the state. Bail is normally established by the counties, but this kind of changed it for the state while we're under the state of the emergency, plus 90 days. So this will extend 90 days past the end of the state of the emergency. And with that, it lowered bail to 0 for many most misdemeanors, with only a few exceptions, and also for several felonies. So what this is going to do is that it will allow many inmates to essentially make bail, because it's now 0. And so we are computing those numbers now. We have over 840 pre-sentenced inmates that we have to evaluate to see if they meet the criteria for 0 bail or not. But we expect that by Monday at 5 o'clock, when we have to implement this, we expect that we're going to have to, by state order, release several hundred inmates back into the county. We're not sure exactly on that number, and we'll have better resolution by the end of the week. But we do. We expect that at least a couple hundred inmates will be released. And the specific intent of this is to prevent the spread of the coronavirus within the jails. And these are, again, they're pre-sentenced inmates, so they're awaiting their court date. They will still have a court date. They're going to have to go to court and have their cases adjudicated in the future, but they will not be in custody while they wait for that. So kind of on the second part of that question, as far as what will the impact be to the community, well, I can tell you that statistically speaking, we are going to see a rise in crime. Over 70% typically recidivate and commit other crimes within a fairly short period of time. So you will see an impact, a negative impact on our community.
There was another question that came in from Facebook during the week. Here in the county, have we already seen an uptick in crime?
The answer to that is yes and no, and it's limited really to some specific categories. As a general rule of thumb, calls for service are down, and that's a good thing. There are fewer critical incidents happening, but we have seen crime trend upward in a few specific areas. One is theft-related crimes, burglaries, grand theft, etc., and specifically more around the commercial areas. Obviously, a lot of those businesses are closed, and so there's a higher opportunity, a greater opportunity for criminal activity in those businesses. With that being said, we have increased our patrols, specifically our extra patrols, we call them, to counter that, and that has proven to be very useful already. But theft is up. Auto theft is up, so someone stealing a car. CHP is reporting that they are seeing an increase in auto thefts as well. Domestic violence is up. Unfortunately, with people staying at home together, that can lead to tension and stress over the virus, over job, money, financial issues, family concerns, whatever the case may be. This is a stressful time for everyone, and so we are seeing domestic violence up as well.
I'm sorry to hear that. So we're going to ask a couple of questions to Supervisor Olson now. First of all, we've had over 1,000 questions come in from Facebook regarding help for those whose businesses have been affected. Can you talk for a minute about our new business support branch we've just activated as part of our emergency operations and what the key objectives of the business support branch are?
Yes, we're excited to be launching the business support branch of the Emergency Operations Center at the county this week. It was last week as we were talking with the sheriff about all of these questions coming in from Facebook and really the need to be able to have an entire team assigned to being able to help businesses answer these questions about what's essential, what's non-essential. For those businesses who have had to close down, how can they seek assistance through either grants or loans? And so this week, the Business Support Branch did open. It's a division of the Emergency Operations Center, and we have a number of workforce development and business experts available to assist you with your questions. Again, the questions that can be answered is your business deemed an essential service? Is there a way you could retool your business so that you could operate safely while abiding by social distancing orders, stay-at-home orders? They're available to assist, and they've already had some successes in that regard. And then the third key piece of the business support branch is to be able to connect our small businesses in particular, but anybody with business questions, with grant opportunities, loan opportunities at the federal, state, and local level. So we encourage you, if you have questions about your own business, or if you hear of others who have questions about businesses right now, you can call 211 or you can call 558-4473, and you will be connected with the professionals in the business support branch. I know one question specifically that came in tonight on this very topic from Facebook from Carl Jones. He says there's so much mixed reviews out there about lawn care being essential and non-essential. Can someone please clarify this in a little more detail? And that's the perfect example of why we've launched this business support branch, to be able to help answer questions exactly like that. And this is a tricky one that we're asked a lot. So again, I encourage you, Carl, call the business support branch at 211, or another way to reach them is 209-558-4473, and they will be able to help you navigate those specific questions.
Thank you so much, Kristen. This next question is from Facebook. This is for Dr. V. And This question is, just how long will we be underneath this virus? I'm assuming this means underneath the stay-at-home order. This specific person heard that the CDC may have mentioned 18 months.
Yeah. So the virus is circulating, and we have no immunity in our population. Basically, it's a new virus, and we don't have immunity. We don't have vaccine. So CDC has been throwing out the 12 to 18 month time frame because that's about the time frame that they're hoping to get a vaccine out. So. Yes, in the next 18 months, we are going to be most likely dealing with this virus in one way or another. Obviously, we're not going to stay at home for the next 18 months. That's too long, but we're going to have to find a new normal to work under. We won't be able to just go back to things the way they are until we're able to prevent infection with this virus.
Thank you, Dr. V. That's very helpful. Let's talk briefly about the surge modeling analysts released yesterday. It would appear as though illness in our county could very well outpace hospital beds in the next handful of weeks if we do not achieve greater than 40% social distancing. Can you tell us how we're doing with social distancing currently?
Yeah, that's a really difficult question because it's so very hard to measure how we're doing. There are a few attempts out there, a few websites you can go to and look at, and it's primarily using cell phone location data and look at how people are moving around. We are doing not so great, it appears, from those data. It is somewhat difficult to compare us to other counties. We do know that counties that have a higher socioeconomic status and have more what they call white-collar workers, have more ability to work from home, rather than, say, a farmer that you can't work from home. They're going to be out in their fields. So we are not probably going to be able to decrease our movement as much as some other counties. But it looks like, looking on our disease, we're probably holding to that on track of 40% decrease. It would be better, more is better, so that we do not go over our hospital bed capacity. And so really how this all goes will depend on how well we stay at home and slow the transmission of this virus down.
So I want to let the community know that we have a video that Stanislaus County CEO Jody Hayes and Gino Patrizio, CEO of Memorial Hospital, created today, and it goes into detail about the surge modeling. So we will post that video immediately following our Facebook Live segment so that the community can learn in more detail about what we're sharing related to the surge. You talked last week, Dr. V, about this a little bit, but can you remind us why pushing the peak back is so important?
Yeah, so pushing the peak back saves lives, so that's why that's the ultimate goal of pushing the peak back. We know that if we do nothing, we way go over our ability to respond to this virus. Our hospital systems will be completely overwhelmed, and so more people will die. And because if they don't have a bed, it's not just the people that have this coronavirus that will suffer, but it's anyone who gets in a car accident and the beds are very short. Anyone who has a heart attack, gets acute appendicitis, their appendix goes bad. I mean, it could be anyone of any age that all of a sudden goes to the hospital and needs a hospital bed, and if our hospitals are full, that becomes a real problem for the entire community. So pushing the peak, or really using the social distancing to flatten the curve, as everyone has heard now, is really all about saving lives and keeping the transmission down to where our healthcare system at full capacity with all the things that we are doing will be able to respond to everyone who needs help.
Thank you, Dr. V. This next question is for Sheriff Dirkse. This came in from Chad Harris, and is in regards to the Judicial Council removal of bail for nonviolent crimes. Chad wants to know, once they get released, will they have a tracking device? And if they commit another crime, will they get higher charges?
Yeah, the simple answer to that is no. No to both. There is no mechanism in place for a tracking device on them. I could go on about Senate Bill 10, and it's going to be on the ballot this November. as a ballot initiative. But ultimately, if cash bail goes away in the state of California, there will be a full assessment process that will replace it, that will assess the risk of someone who is arrested and whether they'll either reoffend or what their threat to the community is while they're waiting for the case to be adjudicated. Once that goes into effect, then there may be the opportunity for something like a GPS monitor or something like that. But now, under our current order and our current situation, no. This just was passed on Monday, and there is no provision in the order for us to do that. Just quite frankly, under the legal statute, it doesn't exist for us to be able to do that at this time. And as far as kind of the second part of that question, will they get some sort of enhancement? The answer to that is also no. There is no mechanism under this order for them to get an enhancement specifically while they're out for violating the order. Now, if someone is out on bail and they commit another crime, there is already a legal mechanism where someone could get an enhancement. There are qualifiers to all of that. So that is still a possibility. But just as a general statement for violating their bail while out under this order, no.
Thank you, Sheriff. Supervisor Olson, let's talk about the board action yesterday. There's a small business relief grant program of up to $1 million to sustain small business operations and retain employees through this crisis. Can you tell us about this program?
Yes. So as you said yesterday at the Board of Supervisors meeting, we passed a program called the Small Business Relief Package, and it's available for small businesses who employ 50 or fewer people in Stanislaus County. Those businesses can be in an incorporated city or in an unincorporated area of the county. As long as they have 50 or fewer employees, they are eligible to receive up to a $10,000 micro grant to help bridge the gap between that and larger state and federal resources. The goal, of course, is to save jobs in our community and to help small businesses be able to reopen or stay open for some of them during this difficult time. There's some criteria there on who's eligible and who's not eligible. People can find more information about that and an application at stanworkforce.com. The application period will open this next Monday, April 13th, and it will be open for a week. And again, the week of the 20th is the goal for being able to get these $10,000 grants out to small businesses in order to help them stay afloat during this difficult time. I also have an op-ed in tomorrow's Modesto Beat that talks a little bit more about the program and where they can learn more information.
That is going to be really helpful for so many small businesses in our community. That's great news. We heard recently that San Diego County has a similar program, and it funded 5,300 applicants. Yesterday, Supervisor Withrow suggested in his comments that $1 million may not go very far in Stanislaus County, and you added that we would love to see other businesses come alongside us in this effort. How much support do you think we need?
Yes, we would love to be able to expand this to help more businesses. Right now, we have about $1 million in the funding that we've identified, which would allow us to help about 100 businesses. As you mentioned, in San Diego, this program opened about 2 weeks ago, and within 9 days, they had over 5,000 applications. And we expect we'll have similar numbers, not that high, but in comparison to the 100 businesses we're able to help at this point. So we're encouraging companies, individuals with resources who could provide matching funds for the program. If we could double that and make it a $2 million program, we could serve 200 small businesses in our community, double the number we're able to now. One possibility is Valley First Credit Union has come along as a great partner. They're going to be part of the selection process for awarding these grants, and they are also in communications with their board of directors about whether they could come alongside with some of those matching funds. But again, if you're a large business in our community or an individual with resources to support, we would welcome your contributions to be able to match this program to help 100 more small businesses and their employees get us through this difficult time.
Thank you so much, Kristen. That's some encouraging news. We're receiving multiple questions on this, and this is for Dr. V right now on our live Facebook feed. Is it true that the next 2 weeks are going to be the worst days to go out for essentials?
So we think that we're nearing the peak of disease transmission. sadly, we can only really tell that when we look back. But when we look at how we're seeing disease counts rise, that this is probably the time when we're seeing the most transmission, because the most people, before the stay-at-home shelter in place was put in place, people were already infected perhaps, and then there's still some household transmission. So we're hoping that that's starting to decrease. But looking at how that plays out in other countries, the prediction is that we're heading into probably the weeks where we'll see the most cases each day.
So we talked a moment ago about the surge and those statistics. How is our behavior right now going to give us accurate data for a month out? Can you talk a little bit about the timeline of a positive case?
So it's hard, and when we look at modeling, what we need to keep in mind, there's a couple different models out there. There's the model that talks about disease and cases and new cases and what we see, and that's the one that we're talking about, peaking in the near future. And hopefully that's going to come to pass. But then we look at hospital beds and hospital surge, and we really are looking at that about a month out, because when someone gets this coronavirus, when they get sicker and need to go to the hospital, it's usually in their second week of illness. It's not right away. It takes some time to develop. And so if people are just getting ill now, it'll be at least another week until that will show up in our hospital bed need. And as we continue to see the hospitals fill up, the hospitals peak quite a bit later than disease. So we just have to keep in mind, when someone goes into the hospital, the average has been 7 days. If they go into the intensive care, the average is 10 days. So you can think of people needing those beds for a significant amount of time, and that's why hospital most need for beds comes later. So I've heard people say our hospitals aren't impacted, so we don't need to stay home. But what I want to say is that our hospitals, our behavior today is going to be reflected in how our hospitals look in the next 4 to 8 weeks. And because of that, and because we've seen what happens in Italy, and because we've seen what happens in New York City, in the city of Detroit, in New Orleans, we know that this is coming at us, and we need to do everything we can to prevent it from happening here.
Thank you for that. So this question for Dr. V, again, comes from Facebook. Rachel Cisneros says, I heard they're using plasma from recovered COVID patients to treat the critically ill. Is Stanislaus County going to collect plasma from recovered people to prepare for critically ill in our area?
So that is a promising practice, and that's been used with other infections before. So it's being done under study and under there are guidelines that have to be followed. So we are talking to our healthcare providers about putting that into place, but we have to follow guidelines and protocols.
Thank you, Dr. V. This next question is for the sheriff. This is based on some comments that were made earlier. Dennis Schmidt wants to know, so the government is tracking our cell phones now. Who has access to this information?
Yeah, so with this, the government is not tracking cell phones. Most of this is all through private vendors. So when you buy a cell phone and you sign up for apps and download them and agree to everything, in there, since no one actually reads the fine print, you are agreeing to share your data with these companies, and they, of course, sell it and make money off of it. So what they do is, in this particular case, is they are aggregating the movement of it, and they're showing how far you are moving every day. And none of this is identified with personal people. It's just an aggregate of how much are cell phones moving in Stanislaus County, in the state of California, in the western region, whatever the case may be. So in this particular case, that's what they're doing with that data. They're just seeing how far they're moving. It's not tied to any individual people, and it's not the government that's doing it. It's these private companies that are doing it.
Thanks for that clarification. The next question is also from our live Facebook feed. This comes from Christy Clausen. Christy wants to know, what is Stanislaus County doing to enforce the stay-at-home order right now? How did they get the word out? Is it through social media? Is it through news? Because she's saying that not everyone has that not everyone has access to those things?
Well, I think that at this point, everyone has heard about COVID-19 and the coronavirus. We do a lot, obviously, via social media. That is the kind of the direct access platforms that we have. We're in regular communication with our traditional media, specifically locally our local newspapers. We don't have any real TV outlets here in Stanislaus County, so we don't do as much through TV. But I think that at this point, everyone is out there. Everyone knows that this is what's going on, and there is more information available than, quite frankly, I think most people can digest in any given day.
Thank you, Sheriff. Last week you talked about the fact that you were beginning to do some outreach to businesses that weren't in compliance, and you named those types of businesses. Can you tell us how successful those efforts have been?
Yeah, that we were actually very successful, and I would personally like to thank those businesses that we contacted. Very, very little pushback, just some education from them or with them, and the vast majority, like 98%, complied immediately. With a couple of them, there were a couple of tweaks that had to be made. They had to maybe do some shutdown of their business and so on, but it's been very successful, and we've not had to go to any more stringent measures with any of them. So to all the businesses out there, thank you. Thank you for doing your part.
Thank you very much, Sheriff. This next question is for Supervisor Olson. This comes in from Wayne Mott. Wayne wants to know, although a federal program is in place, do you know why local banks are not getting the payroll protection loans processed?
We've had a lot of questions about these paycheck protection loans, which is part of the federal stimulus package. And we're hearing a couple of different things. It is correct that businesses are supposed to apply through their local lenders, through their local banks. And part of the challenge is some of the local lenders are already oversubscribed. The good news is the federal government is working on a phase 2 of this program that could open up additional resources so that more monies will be available so that banks can reopen the application process. So it depends on which bank you're at. Another potential challenge is there are still some local lenders who are still going through the SBA approval process to become eligible lenders through the Small Business Administration. So they can keep checking back with those local lenders to see when they're on that approved list, but mostly it's because of they're just oversubscribed. So I would encourage people to go to the Business Support Branch. Again, they can be reached at 221 or 558-4473 to get additional updates on this program, or stanworkforce.com will have information on that as well. But the big challenge is just there's so many people applying for the funds.
We know the need is significant right now. Will the $2 trillion CARES emergency stimulus bill, also coming from the federal government, help, and how?
It will help. As has been said, $2 trillion has already been allocated, approved by Congress, to go out into communities through a program called CARES. They're now working on phase 2 of this program as well, which is expected to allocate $454 billion back out into communities, both for cities, counties, as well as businesses. My understanding is phase 2 of the program, larger businesses will be eligible for some of these funds as well, not just the small to medium-sized businesses. So we're still waiting for final approval from the feds on that program, but I expect it to come out soon so that we can reach a greater number of cities, a greater number of counties, and a greater number of businesses with that support.
That's encouraging. So this question came in from Scott on Facebook. He wants to know if it's true that cities under 500,000 population size were left out of the CARES Act.
Out of phase 1, yes. $2 trillion sounds like a tremendous amount of money, and it is, but across an entire nation, that doesn't go far enough to reach every city and county. So they did have to put caps on that, and cities like Modesto, like all of the cities actually within Stanislaus County, didn't make the cut. But we're hopeful that in phase 2, some of those cities will be able to receive federal stimulus dollars. And that's our understanding from Congressman Harder and others that we've been working with.
Thank you, Kristen. By the way, we wanted to remind those that are tuning into our Facebook Live Q&A right now that some of the questions may have already been covered in previous questions. So we do want to encourage you to go back to the beginning once this is posted onto Facebook to ensure that you have all of the information. This next question is for Dr. V. This comes from Chessie Garcia. Chessie wants to know, are there any resources at the city or the county level that is actively working on getting hospitals in our community personal protective equipment?
Yeah, so we have systems in place, and we have many people working on doing this at the local level, at a regional level, at the state level, and at the federal level. So we are all trying to get PPE, so our healthcare workers will all be protected, and it's really one of our highest priorities. And so, yes, we're all working on it. I'm hoping that manufacturing gets up and our supply increases very soon. Airplanes are coming in. It takes a while to get down to everyone, but there are many people working on this.
This question is for Sheriff Dirkse. Speaking of PPE, personal protective equipment, are your deputies going to begin wearing masks?
Yes and no. We've ordered 1,200 of the fabric face coverings. They are a neck gaiter, if anyone is familiar with that, and they're going to be black. So we are going to issue those as soon as they were here, or as soon as they are here. They have also all been provided with the standard PPE, the N95 masks, gloves, etc. With that, though, because there is a shortage of PPE, the proper PPE, we only wear those when needed. Now, the deputies will have the fabric face coverings, and they will be given guidance regarding wearing that, but it will also be somewhat at their discretion. I do bring that up, though, because if you see a deputy maybe come into your house for a call for service or something like that, and they're in uniform, as I am, and they have a black mask over their face, don't be alarmed. They're just doing that, obviously, for your protection. But I do want to put that out there. And we will actually, through social media, probably put out a picture of a deputy wearing that once they're here.
Along the lines of protection, one of our Facebook followers asked, what are you doing to keep those who work in the jail safe?
Yeah, so we've done a number of different things really across the entire organization. Our jail has medical staff there. And every staff member that goes into the facility has to have their temperature taken and be screened every day. And that applies both for our custodial staff and for our operational staff as well. Any person who books an inmate, regardless of what agency that they are from, they have to go through the same medical screening before they even get in. So our staff they have the PPE, they go through a medical screening. Obviously, if someone doesn't pass the screening, they go home to protect both them and everyone else that they work with. We've done a number of things just internal to our organization to kind of compartmentalize it. So deputies could roam throughout the organization and deal with whatever business they had to. But we have tried to, like I said, compartmentalize that just to restrict that movement. It doesn't mean that we don't handle internal business, but obviously we do a lot more of it now, either by phone, through some sort of a conference call, Zoom, Teams, all the various programs that are out there. But we just do that so that way there's no spread within the organization, so that we have staff who can stay out on the streets to protect the public.
Thank you, Sheriff. This next question is for Supervisor Olson. We're getting multiple questions about this on our Facebook feed. This person says that they're having some trouble applying for unemployment insurance and can't get through to EDD by phone. So what can they do?
This is a huge challenge. Governor Newsom has talked about this in many of his 12 noon press conferences. And it's not a new challenge to EDD. I remember when I was in the state assembly during the Great Recession, we had so many complaints about never being able to get a hold of EDD. And eventually they were able to staff up. And so I know state government is working at providing more manpower resources to EDD, but that could take some time. So in the meantime, we're recommending two things. One, contact EDD during off-peak hours, and it might be easier to get through. The second option would be to go to our business support branch, again at 211 or 558-4600. 4793 or their website, stanworkforce.com, and ask for assistance in how to navigate through the EDD process. But it is simply a manpower issue. They are overwhelmed with calls, and the state is trying to add more staffing to that department in order to help more people in a timely way.
So, Supervisor Olson, what advice do you have for job seekers or the newly unemployed outside of EDD?
Yeah, such a difficult thing. Numbers vary as to how many people have been laid off and are unemployed right now, but whether it's 1% or 30%, people are really struggling in our communities. And so there are a few opportunities locally. Once again, they can go to our workforce development team. They can reach them at the same numbers I've already reported, or perhaps an easier one for workers to remember is 558-WORK. And they are ready to assist, connecting them to job training opportunities, connecting them to job openings that they are aware of. A lot of grocery stores are actually hiring right now, so there are some jobs available during this time. Another statewide resource is onward.ca.gov, and the state has partnered actually with a Fresno-based company named Bitwise to help provide employment opportunities and connect people who have been laid off from their jobs with new opportunities, both training and actual jobs. So those would be the two resources that I would recommend. Our Workforce Development Department, they can call 558-WORK, or going to onward.ca.gov in order to seek additional job training or job resources.
And then the other question along that line that came in was about those who are self-employed or part of the gig economy, and what would you have to say to those people?
Yes, this has been I've received a lot of questions about this myself, a huge challenge. The good news is the phase 2 programs that the federal government is working on is also supposed to apply to self-employed individuals, small businesses who may just employ themselves. And so again, those resources aren't available yet, but we expect them to come online soon. And I would refer them once again, I'm sounding like a broken record, but Business Support Branch, it's exactly the reason we launched this. I believe it was Sheriff Dirkse's original idea, just understanding how many individuals, how many businesses are out throughout Stanislaus County who don't know where to turn. So they can go to the Business Support Branch, and they will be one of the early, or if not the first people to know when these programs are available for people who are self-employed.
Thank you, Supervisor Olson. This next question actually has come in multiple times. It is for Dr. V. You've talked about this quite a bit in recent weeks. Can you tell us your recommendations for masks, or what I know you like to call face coverings here in Stanislaus County?
Yes. So the face coverings, we don't want them to be masks, so we don't want to take any of our personal protective equipment away from our healthcare workers. So we want to call them face coverings, and we want them to be out of cloth. So there is a thought, there are no data behind this, but it is thought that if someone could possibly have the coronavirus and they're not yet symptomatic, or they're not going to become symptomatic, so they're either the asymptomatic or the pre-symptomatic, that they, by wearing a cloth face covering, would prevent transmission from them to other people. So it's a good, we think, with no data, way to protect people and to slow down transmission. But what we want to be sure that everyone remembers is this does not replace social distancing, so we still need to keep 6 feet. But if you're going to, say, the grocery store, and it's sometimes really hard to keep 6 feet away from people, you pass and you're standing in an aisle looking at the same cans. So it's a good place to wear them. So 1, it doesn't replace social distancing. 2, you really need to wash your hands still frequently, especially after you take off the mask. You need to wash the mask frequently after you wear it, or the face covering, the cloth face covering. And you really need to not touch your mouth and your nose, your face. Sometimes when you wear coverings on your nose and mouth, you're going to touch your face more, and that would defeat the purpose of wearing one. So there are a lot of, we think there can be some good out of this. We want to make sure it doesn't cause more harm by people then not social distancing, then forgetting their hand hygiene after they touch it, and things like that. So I think it's a good idea. We're promoting it, and many other counties are promoting it actively, but we just need to remember that it's not the answer to everything.
Dr. V, I wanted to stick with you for just a moment because we're getting a lot of questions on this right now on Facebook. When do you think immunity testing will be available in Stanislaus County, and will all people get tested?
So for the immunity testing, I mean, that's a common way we test other viral diseases, right? We look for immunity for measles and mumps, and so we use this test quite frequently. There is one FDA approved. There may be more now. I know Stanford seemed to be on the brink of being FDA approved, and that would be great. So hopefully it's coming soon. Where we want to use it, I'm not sure. There's been a lot of discussion about how we can use this test. Some people have said it'd be great with healthcare workers, so we'd know who was immune and was now protected, at least short term, if not long term, from this infection. I do hesitate to say that everyone would be able to return to work with this test. No test is 100%. So, sometimes there's cross-reactivity with other coronaviruses. If you remember, there are other coronaviruses that circulate in the winter and cause about 30% of our common cold. So we need to make sure it's specific for this one. And we don't want people who really need their job going out and getting infected so they can return to work. It shouldn't really be a criteria for that, because I don't want people endangering themselves because they feel like they need to return to work. So it'll take a lot of thought and to really look at how to best use this test. So it will be great. We want to make sure it gets used appropriately.
Thank you, Dr. V. I'll stay with you, but I want to make a quick comment, a housekeeping comment. We had a lot of people send DMs, direct messages, in last week while we had our live Facebook event going, and we want to let the community know that we are only going to be able to answer during this hour questions that come in directly in the comments. We can't look at our DMs right now and keep up on those in the same way, but we may bank them for next week. Dr. V, we asked you this last week, but we will keep asking because it's a very popular question. Are there any new treatments available that you know of? Obviously, there's been a lot of conversation about hydroxychloroquine. What can you tell us about that?
Yeah, so the hydroxychloroquine is kind of tough. In a test tube or a petri dish, however they test it outside the body, it looks like it has activity against this coronavirus, so maybe it can kill it. It also looks like it has activity against flu. That's been looked at before. When studies were done with influenza, it did not do anything to people who were infected. It did not make them better. It didn't protect them in any way. So we really don't know if this is going to help or not. Some people have been using it under a study, and when you do it under a real study, some people have not been seeing results. There have been some people that have promoted it. I know there was a study out of China and I believe one out of France, but they're very small. They didn't blind it, what we call blinding, so people knew what they were getting. And we always have to remember that the placebo effect is very real. It's about 35% of people who will feel better just by getting something and knowing they're getting something. So that's why we like to have people not know what they're getting. So we know that it's the drug and not the placebo effect. So there are a lot of things that need to be taken into account. Sometimes when people want to see a result from something, they will choose less sick people to give it to so that it looks like it does better. And they're not meaning to, it's just that's the way it comes. So there are a lot of things that have to be looked at. I hope people can go, the FDA has posted their patient information from their emergency use authorization. It's on their website. And I would urge you to go read that because it's a nice summary of what we know and really what we don't know. We'll summarize the side effects because, of course, there's going to be side effects. And so I think it takes a lot of thought, and I would like to know that this is a good medication that will help you, because if it's not going to help you, then it's all you have then is the side effects. So, I hope it works, but we really need to look at it. So that's the hydroxychloroquine and the plain chloroquine. So there is also remdesivir, which we talked about way at the beginning of all this. I think that one's looking real good. So hopefully we're seeing some medications come that will be helpful. So we will know lots of studies being done. So hopefully we'll know soon.
Thank you, Dr. V. This next question is for Sheriff Dirksey. This question comes in from Stephanie. Stephanie is seeing online that other counties are giving fines for not wearing masks. So she wants to know, is this true? And if so, will our county start doing this? And what if she does not have access to get them?
Yeah, so I have heard that other counties are doing that. We are not going to do that here in Stanislaus County. Under the current order, there is no mechanism for us to really do that. Anything that we would enforce is a misdemeanor, and so you could be cited for that or booked into the county jail. As we discussed earlier, under the state's, the Judicial Council's order, bail for that would also be set at 0, and so there's the enforcement side of it has somewhat been negated by that. And we also heard, and I think probably more importantly, we just heard Dr. V talk about the fabric masks, that there is not necessarily data that supports the utility of them. And I'm not really going to speak to the medical side, that's not my area of expertise, but I think that it would be counterproductive for us to do that. There is no desire to make anyone a criminal out of this.
How about people who fish? This question comes in repeatedly. A lot of people are asking if they're allowed to go fishing on their own boat and what Fish and Game has to say about that.
Yeah, so I can tell you that that as it sits now, you can go fish. There are still some places are closed. The county parks are closed, so our local reservoirs are closed. Many others are as well. Obviously, that presents a challenge for finding a spot to go. You can still go in Fox Grove and fish in the river. I think the Delta is open, so fishing is still okay, as long as you are doing it either by yourself or with someone from your household. I don't think that there's any problem with that. What I will say, though, is that California Department of Fish and Wildlife is apparently having some sort of a meeting or conversation on this very topic tomorrow at 8:30 in the morning. So I do not know what will come out of that decision.
Sheriff, I wanted to stick with you for just a second because this is also an enforcement question that came in from Facebook. Rizar Rezout, why can't we just strictly reinforce or enforce compliance for the next 2 to 3 weeks so that we can prevent our numbers from going up? And this is in terms of the stay-at-home order.
Right. Yeah, so the challenge with the enforcement is the ability to do it. And I say that specifically around the fact that it is a misdemeanor. There is no other local, it's not an infraction, there's not some other category to it. You know, we talk about this idea of issuing fines. There is no legal mechanism in place in Stanislaus County for us to just fine someone for this. You would have to be arrested for misdemeanor violation of the emergency order in this case. And so with that, we've already talked earlier tonight about this whole judicial council piece and the fact that we are releasing inmates from our jail by state order so that we, in theory, prevent the spread of the coronavirus inside of our facilities. Well, it would be counterintuitive then to go out and arrest someone, even if we only issued them a citation, to enforce this. And I'll go back to the governor's original order. The governor specifically said he did not want this to be a law enforcement function. He wanted social pressure to take care of this. And we have been operating under that from day one. I think that if everyone would simply follow the guidance that is out there, stay at home, social distance, practice good hygiene, we're going to get through this much, much faster.
Thank you, Sheriff. Supervisor Olson, there are questions coming in about your earlier comments related to the $2 trillion stimulus bill. Mary Shaver is asking if she heard correctly that Modesto isn't going to get any money. Can you clarify that?
Yes, appreciate the question, so we can clarify. So earlier when I said Modesto will not be getting funds, I was referring to the city itself. So the jurisdiction of the city of Modesto isn't eligible for the funds under the first stimulus CARES package because it's under 500,000 people. However, individuals and businesses within the city, so the $1,200 per person that was made available through the first phase of the CARES Fund funding. Certainly everyone in our county is eligible for that. So appreciate the follow-up questions so we can make it clear. Individuals and businesses in any city across Stanislaus County are eligible for those stimulus funds. We were simply referring to the city itself. We'll have to wait until the second package comes through.
Another question for you, Supervisor Olson. Chuck and Andrea Carlton are curious about the Small Business Micro Grant Program. Can you repeat the start date for that program and the website?
Yes, so as we had said, Stanislaus County has launched a new business relief program for small businesses of 50 or fewer employees that provides up to $10,000 in micro grants. The application window for this program will begin next Monday, April 13th, and will be open until the following Tuesday, April 21st. So there's an 8-day time period in order to apply for these micro grants, and those funds will be awarded sometime later in the week of April 20th. And you can go to www.stanworkforce.com in order to download a copy of the application and submit your application online.
Thank you, Supervisor Olson. This next question is for Dr. V. This came in from Facebook during the week. This person says, we're at the tail end of this first 14-day shelter order and a week from the executive order. Are we achieving what you had hoped to see, and do you think we have flattened the curve?
Yeah, that's a really hard question. I think I talked about that mostly a little bit earlier. It's one of those things that we're going to be able to see looking back. We definitely have flattened some. That's very clear. I mean, we have. I think we are doing a better job of staying socially distant. I think we could do a better job still. To try to flatten it a little more. We really need to watch how things go in the next week or two, and I think that will give us a good idea how much we have flattened the curve. It's just so early, sadly, that it's really difficult to tell. Remember, if someone gets infected, the average time it takes to become ill is 5 days. It can take up to 14. Most people, the vast majority, are start feeling ill by about 11 and a half, 12 days. But it can take some time, and then they're usually sick a couple days before they get tested, and then the test takes a day or two to come back. So we know we're probably about a week behind when we get our tests of when someone got infected. So it just takes a little bit of time, and we have to look back, and we will be able to tell, I hope, in the next week or two.
Dr. V, here's another tough question. This one's from Rob on Twitter that came in earlier today. Has the governor or any elected official indicated what the trigger will be to lift the current mandate? So, in other words, is there a benchmark we're shooting for? At what point will we consider the curve flattened?
It's a really great question, and there's a lot of discussion about that, certainly between all of us local health officers. I mean, we were just talking about it this morning on a call. So we have not heard from the governor what he would consider to be triggers for lifting the order. He put the order on, so he needs to be the one to lift it. We're hoping that he'll work with us to help define that so that we can get things in place as well, because the state is not all in the same place at the same time. The Bay Area went first kind of with having increase in infections, and we were lagging behind them by a couple weeks. Southern California seemed to be a little later than them as well. So we're in very different places on our curves, and so we aren't all going to arrive at the same place by the end of this. So I think we need to have a very good plan in place for where each county is when the time comes to lift the stay-at-home order. So we are actively talking about it and reaching out to the governor's office to get his thoughts on this as well. So hopefully we'll be able to work on this in a very nice coordinated plan.
Dr. V, this is also a question for you from Facebook. This came from CK Ringstead. When will we share modes of transmission on our website?
We are looking to share that very soon. I can give you some data today. About half of our cases, just a little under half, are contacts of known cases that we find in our contact investigations. So, and about a little less than half a little bit less than that are what we consider community spread, as that's defined by we don't know where they got it. We don't know of a known contact that they've been in contact with. And our travel cases are right now about 12. We don't have a lot of travel cases anymore because people are not traveling. So I don't expect that number to move much.
Dr. V, this is a question I think you sort of addressed a little bit earlier, but I think the second part of it is valid and worth restating. Is our testing capacity increasing? And where and what are the numbers? Can you tell the community where to find that information?
Yeah, the governor has put together a task force to really work on this, and we got an update on that last night. They're really trying to move forward with getting a lot and really increasing our testing capacity in California. One of the biggest barriers we still run into, it's not anything to do with the lab, it's the swabs to take the sample with. They are still, and then you put them in what's called viral transport media, and there's a couple other things we can put the swab in to be able to send it to the lab and make sure it doesn't degrade, and so we can get an accurate test. So those remain to be in quite short supply. So it has to be solved before we can expand testing, because if you can't take the sample, it doesn't matter how many tests we have in the state, we can't do them without the ability to take samples. A few more options for samples have come out. Sample collection, and right now we talk about that nasopharyngeal swab, so it's a longer swab that goes through the nose back to the back of the nose. There's also a way you can swab the front. It's not the preferred method, but it's an option. So there are a few other options that are being looked at, but really that's the thing limiting us right now.
Thank you, Dr. V. This next question is for the sheriff. This comes from Brooke Davis. Brooke wants to know, do any of the inmates have COVID-19 in the Stanislaus County Jail?
No, none of our inmates have it. We have tested for it, and they've all come back negative. And I will tell you that my jail team has a great plan for this. We implemented that plan very early on as far as protective measures. My medical staff is very good. And so we are quite confident that we are doing everything possible to prevent the spread inside of the jail.
Thank you, Sheriff. We haven't talked much about homelessness and COVID-19, but this question came in. How are you dealing with the homeless and keeping them apart? Is this possible?
Now, it kind of goes back to the original thing. It's really not possible. There is, again, kind of no legal mechanism to keep them apart. As, again, given the state order regarding the bail, all of most of the crimes that the homeless commit fall into that misdemeanor category, and functionally now we can't book them for that any longer. They're just going to be cited right back out. And so there's a challenge there. And with that, we do monitor them. The county has an entire team that goes out and works with the homeless and works with them as far as their health and safety. And so we are paying attention to that. But as far as that idea of just having them reside together, that's not really something that we can enforce. And the other thing is, we've all talked throughout this about, you can't congregate outside of your household. Well, for someone who's homeless, the folks that they live with in a camp or in a group, that is kind of functionally their household. And so, we're very cognizant of that as well.
Thank you, Sheriff. We have just a couple of minutes left, so I wanted to go back to Dr. V. With Easter coming up, this is a question that's popping up. Why is it important for churches to remain closed?
Yeah, so the governor's order was pretty clear. It's very clear that churches need to be closed, and there's a few reasons for that. There have been quite a few outbreaks associated with churches, including outbreaks, all of them that I've heard of have had deaths. There are many people at high risk for severe disease in churches, and the interesting thing about respiratory diseases is when you sing, you actually tend to spread the forceful singing. You're just really aerosolizing any respiratory pathogens. It's very common with tuberculosis. It's common with other viral infections. So by singing, you actually are more likely to spread respiratory infections, including coronavirus. And there have been outbreaks associated with choir practice in which people have died, and like everybody in the entire choir have become ill. So it's really, it's very difficult, I understand, with Easter Sunday this Sunday, but it is important to protect people, to not come together and risk spreading this coronavirus.
Thank you, Dr. V. Supervisor Olson, kind of a similar question for you, and I think this will be the last question of the evening. Churches are getting really creative about how to bring their fellowship together. We've had questions about whether people can gather in their cars, for example, in church parking lots and listen to services streaming. What would you have to say about that? And what encouragement can you give?
Yeah, sure. This is a question we've received a lot over the last few days, especially with Easter Sunday coming up. And as Dr. V just explained, unfortunately, we cannot loosen the orders when it comes to Easter Sunday, whether it's for gatherings in the parking lot and people in their vehicles or more traditional settings. However, this is the type of question that's perfect for the business support branch. The goal of the business support branch is to try to get to yes, to try to find ways that nonprofits, churches, or businesses can operate safely while abiding by social distancing and stay-at-home policies. But that doesn't mean we're always going to get there. And Governor Newsom at his press conference today made it abundantly clear that there is no exception for church gatherings, including on Easter Sunday in parking lots. But there are so many other creative ways that families can celebrate Easter this Sunday. You can gather with your family and watch church online, practice your faith online. So many, if not all, of the churches within and across Stanislaus County have been providing online services for quite a few weeks now. So I encourage you to call your local church and find out if they have an online service. I know many of them do. And then after church, there are fun ways to celebrate with your family at home. I know my family and I, my extended family, we were texting today. We have a family text exchange and talking about having a Zoom gathering on Easter Sunday where we can watch each other hunt for Easter eggs in the backyard and try to have ways that we can still participate in it as an extended family. Maybe even egg decorating online with your friends through Zoom. So we want to make sure everybody has a great Easter. There are ways we can have a fun time celebrating Easter still at home and practicing our various faith traditions online. And so with that, we want to wish everybody a very happy Easter Sunday in 2020.
Thank you so much. We're now out of time, but we want to thank all of our panelists for being here tonight and contributing to this important community conversation.
And we also want to thank you at home for sending in your questions. If we did not get to your question this evening, we're working around the clock to answer them online.
By the way, you can also find us on YouTube under Stanislaus County Office of Emergency Services. That is new. You can also access our videos on our website, stanemergency.com, and you can find our other messages and updates on Facebook, Instagram, and Twitter. Just search for Stan Emergency.
So thanks again. We'll see you next Wednesday for another Facebook Live Q&A at 5:30. In the meantime, stay home, stay informed, and stay healthy. Good night.